So let's take a closer look at that coronavirus situation. ABC analyst Casey Briggs joins me now. Casey, talk us through today's number. It's the biggest single day of cases since this outbreak began.
Yeah, that's right, Karina, and really every statistic that we're measuring this curve with at the moment has gone in the wrong direction today. Really not great news at all in New South Wales, and for that reason I think we should just presume that this lockdown is not lifting on the schedule of the public health orders. It'll lift when we get basically back down to zero spread, at least zero spread that's had a chance to infect other people in the community. So here's the curve that we're looking at: 44 local cases. You can see the general picture that's climbing, but let me show you the 7-day average. I think it's going to become more instructive over the coming days and weeks. And what we can see is we saw relatively rapid growth after about a week of very small numbers of cases, rapid growth to a 7-day average of about 25, 26 or so, where it stayed flat for a while, but it's just again in the last 2 days started to shoot up again at not too dissimilar a pace, unfortunately, to what we had seen. So what we've seen is it's spread through the eastern suburbs of Sydney. That wave has sort of receded in the eastern suburbs. The numbers are not as bad there as they were. It's remained flat for a while, but then we've seen seeding in the western suburbs of Sydney, and that has kind of contributed to what we're seeing, what has largely contributed to what we're seeing now. These are the cases in the past week. It doesn't include today's 44. We're still waiting on the full local government data for today, but you can see 34 cases in Fairfield in a week, 21 cases in Canterbury-Bankstown in a week. That is about a third of the cases over the week as of yesterday that have come from just those two local government areas, and you can see that's why those areas are definitely hotspots. And the other bad, nasty-looking number that we saw today is the number of people out in the community while infectious. It is at most 34. 27 of those confirmed to be have spent at least part of their time while infectious in the community. Another 7 cases under investigation. So when those 7 cases get clarified, that number might come down a little bit, but regardless, it is still going to be the highest number that we've seen since this lockdown began. That too is trending in the wrong direction. And one last thing, Karina, that's trending in the wrong direction, unfortunately, is the testing numbers, which spiked at the start of July. We are now seeing them decreasing day on day. Today, 40% fewer cases reported, tests reported than the same day last week. You would expect some level of reduction of testing, and that is partly because when you've been in lockdown for a few weeks, when people are mixing less, just less people are getting sick, and so you would expect to be a little bit less testing reported anyway. But when you've got a new wave kind of appearing in Western Sydney, you'd hope that these numbers do start to go up again.
Yeah, so some new restrictions introduced today, including exercise limits and shopping limits. Given that in southwest Sydney, the concern is about households mixing together and there being transmission in that way, are we expecting this to have a dramatic impact on the numbers?
Yeah, I think we'll see big numbers for at least a couple more days, even if everything is going fantastically well. Let me just bring back the curve. What we've seen is, again, as you say, a majority of cases are spreading through close contacts, household contacts, and it sounds like people in mixing with other people in other households. And that has been the main method of transmission in the last few days, not through retail and shopping and places like that. There have been very few confirmed transmission events actually occurring at shops. So you can see that's one of the reasons. I mean, there's been a clarification of some rules. There's been a tightening of some shopping rules because I think there was confusion in the community. But we've also seen quite significantly that reduction in the number of people you can mix with outside your own household to really reduce that level of mixing. I think that might actually be the single biggest, have the single biggest effect on this curve of all of the new restrictions that have been announced today, to try and get those numbers, most of those people mixing between households, going out and mixing, going and visiting other people's houses, all of which, well, that hasn't been allowed through this entire lockdown, but they're really trying to clamp down on that now.
Casey, there's been a lot of comparisons between this particular outbreak and Melbourne's outbreak in its second wave last year. What comparisons do you draw between the two, and how does the Delta variant, I guess, add an increased level of unpredictability?
Yeah, well, the Delta variant has clearly shown that this can blow up quite a bit quicker, and the level of restrictions that have worked in the past are not quite doing it this time around. There are a lot of similarities at the moment in the areas in Sydney where it is spreading. There bear some similarities to the factors that prolonged this issue in Melbourne last year. These kinds of Western Sydney areas like Fairfield, Canterbury, Bankstown, Liverpool, much larger households on average than in Waverley, Bondi, Sydney. We've got much more people that sort of have essential work or casual work where they have to leave the house. You know, the rates of people working in kind of professional white-collar jobs in places like the City of Sydney and Waverley, it's kind of 3 times higher than the rates in Western Sydney. So you're talking about the virus spreading through people and communities that are going to find it harder to stay at home more often. They don't have that income support at the moment. You know, JobKeeper, one of the reasons JobKeeper was created last year was for this kind of scenario where, you know, people cannot leave home. We're trying to restrict the amount of time people are spending outside of the house. Businesses are shutting down, and all of a sudden, you know, people are finding themselves without income, and they just can't do that. So that's one of the factors here. There is a very different factor, of course, and that is that the case numbers in New South Wales are a lot lower than the kind of equivalent point in Victoria. Remember, the lockdown in Victoria was imposed when you know, on a day that we got to 191 cases. We're nowhere near that yet in New South Wales, although we've seen how quickly these things can grow. And it took a long time to see, you know, the restrictions that were put in place in Victoria to get to this point. Took, you know, a number of weeks to be imposed. They've happened in New South Wales quite a bit quicker, or hopefully New South Wales is learning from Victoria there. There are some things Victoria has done or did do later in their second wave that New South Wales is yet to do, and it'll be interesting to see if they're considering some of those things like isolation payments for people who have to get tested but will lose money for doing so. You know, things like that we haven't seen in New South Wales yet that are in place in Victoria.